Hello and welcome to the Scugog Chamber of Commerce Show. I'm Jonathan Van Bilsen and I'm pleased to host this episode. Today our guest is Christina Fuda, the Communications and Public Affairs Coordinator for Ontario Shores Centre for Mental Health Sciences. Before we begin, I'd like to introduce Michael Phillip, the President of the Scugog Chamber of Commerce. He's going to say a few words and introduce our guest. Michael?
Thank you, John. I'm Michael Phillip, President of the Scugog Chamber of Commerce. We represent businesses and business interests in Port Perry and the surrounding area. We are pleased to put forth opportunities for our members to learn how to operate or grow their business, to learn about what is happening in the Scugog community, and to communicate with various levels of government. This year, we are excited to produce a number of online presentations for our members and non-members alike. Our speaker series introduces community stakeholders and provides you, the viewer, with useful and important information available on demand through our website, YouTube, Facebook, and Rogers TV. I would like to thank our generous sponsor, Enbridge Gas. Thank you for supporting business in your local community. I'm excited to kick off the 2022 speaker series with our featured guest, Christina Fuda. She is the Mental Health Training Coordinator for Ontario Shores Centre for Mental Health Services. Welcome, Christina.
So thank you so much for having me here today on this really important day where we're celebrating talking about mental health. And so I really like to thank John and Carrie Ann and Michael for inviting me to speak with all of you today about this. And so I've got a presentation lined up where we're really just going to talk about mental health, and hopefully this conversation continues beyond just today and we talk about it all year long. And so I am from Ontario Shores, so I've been an employee there for about 7 years now. For those of you that are unfamiliar with Ontario Shores, we are one of only 4 mental health hospitals in the entire province of Ontario. So we're located on the Whitby Shores, right down by the lake. There's also Centre for Addiction Mental Health, the Royal in Ottawa, and then Waypoint and Penetanguishene. And so we're the only 4 specialized mental health hospitals. And we're also one of the largest employers in Durham region. A lot of folks think that we only do inpatient mental health support, but we actually have been spending a lot of time expanding our outpatient clinics over the years. And so part of my role at the hospital, which I feel has been a true privilege, is that I get to go around and have conversations like this with people in the community to better let them know about the mental health resources in the area so that we can better support ourselves, we can support our employees, we can support our family members. And that's what this conversation is really going to be about today. And I love that we're doing this on Let's Talk Day because to date, Let's Talk Day has supported has raised over $121 million to support over 5 million Canadians accessing care for mental health. And so please use that hashtag today and help contribute to those funds. Even in Ontario Shores, I know that it has helped us, especially in the past year, improve our Recovery College in conjunction with Canadian Mental Health Association. And Recovery College is really about people with mental health taking courses to better learn about their mental illness and ways that they can recover. So really wonderful program that I know this day has been instrumental in helping us support. And so I wanted to start off my presentation by just sharing with everyone, I think something that we already know, that COVID has had a huge impact on our mental health. And here we are in the second winter, and this is just kind of showing you some of the fluctuations that we've experienced over these past couple of years in terms of our mental health. I don't have it going past March of last year, but I've looked at the recent numbers and they're pretty similar. And in a good year, so prior to COVID, we would be looking at about 20% of people in the Canadian workforce experiencing mental health problems that are impacting their ability to do their job. But since COVID started, we're hearing from 81% of people saying that COVID is having a negative impact on their mental health. Now, that is not saying that every person out of those 80% are experiencing a mental illness. 49% of the 80% are saying that, yes, they're experiencing negative mental health concerns because of this pandemic, but they're still finding ways to cope through it. versus about 32% out of that 81% are saying, no, I'm really struggling and I'm not coping very well through this. And so I just wanted to share this to recognize that, yes, we've all been impacted. And I think we've seen that we've all been impacted. And so this chart here is just really showing that just because our mental health has possibly been lower than our baseline, it doesn't necessarily mean that we have a mental illness. As many of us can experience poor mental health, but find coping strategies, ways to get through it that can get us back up to our optimal mental health level. Many of us are probably right around here, is we're maybe not functioning optimally, but is we're not experiencing a mental illness. Versus there are a lot of people, though, that this past year, as I mentioned, have experienced significant symptoms that has gotten to the point where they need medical treatment. And so that would be over on the other side with serious mental illness. But what I love about this chart is that just because a person has been diagnosed with a mental illness does not also mean that they have poor mental health. There are many people living with mental illness that are functioning very well. They're going to their doctor, they're talking to counselors, they exercise, they eat good, they have a good social network, hobbies. And this person that you work with or a loved one could be living with a mental illness, but you can't even tell because they're managing it very, very well and they're functioning at their optimal mental health level. So I love showing this chart to folks because it really is trying to help break down that stigma that we are all going to experience times where our mental health gets low, and that even if a person does have an illness, it does not mean that they aren't able to function. And so who is at risk for developing a mental illness? We looked at that 80% of us experiencing mental health problems within this past year, but we are all at risk for developing a mental illness because we all have one of these, we all have a brain and our brains get sick, just like how our bodies get sick. And so I love talking about the symptoms next, because remember that this is just an organ, and it's an organ that is so important, that is functioning, allowing us to function in all these different areas of our life. And so our brain is responsible for our thoughts, our perceptions, our emotions, but not even just those cognitive functions. It's also our physical health and our behavior. So on the next few slides, I've broken down the signs and symptoms of things to look for in yourself and in each other to recognize this person needs support, and then breaking them down by these different brain functions in different areas. And so starting off with the first couple is our cognitive functions. So these are our emotions and our thoughts. So how to recognize when somebody might be experiencing mental health problems or illnesses. Well, let's start with the emotions because it's the one we think of first, often when we think of mental illness. And excessive and inappropriate worry it's healthy and normal to worry when there is something to worry about. And we've all had, a big stressor this past year. However, it becomes excessive and inappropriate when it's starting to interfere with our day-to-day life. So if we're starting to worry about things that don't exist, if there is no stressor, or we're worrying things to the point where it's actually starting to cause disruption, that's where we could consider it as excessive or inappropriate. For example, is using the workplace as an example, is that it's okay to worry. For somebody that loses a job, they should be worried because that worry is going to motivate them to work on their resume, work on their LinkedIn profile to find themselves a new job. Versus somebody that has a stable position, but is constantly thinking to themselves, oh my God, what would I do if I lost my job? What would I do if I couldn't, put food on the table? That would be excessive and inappropriate worry because there is no stressor present. So that's the example between the difference. And then that worry can even interact and interfere with their ability to do their job, effectively. Now, anger, irritability, this is a big one. I think lots of us have felt this past year. I know I myself, I am not an angry person, and I've seen myself being even more angry than usual. But I'm going to share with you some links to our blog. Even at the hospital, we have a blog, and I wrote an article a couple weeks ago to try and alleviate some of my own anger this past week, and helping discuss tips that we can do to help us alleviate our anger in a healthy way. So if you're noticing it's starting to interfere, though, anger is healthy. Anger is normal. There's nothing wrong with feeling worry and anger, even sadness. Sadness is a healthy emotion. But if it's getting to the point where it's impacting our life, it's impacting the things that we love to do, and if it's starting to cause hopelessness, hopelessness is also, a healthy emotion that we all feel from time to time. But if these emotions are lasting too long, particularly sadness and hopelessness, if it's been at least a couple weeks and it's impacting our relationship with our families, our ability to do our job, our physical health, that's where it might be a good idea to reach out to a professional. Now, emotions, thoughts, and behaviors are all very interconnected. So that's the emotional decline for our mental health. But thoughts, we'll start to notice really listening to our thoughts and listening to each other. Is the person starting to talk more negatively? Are they expressing more negative thoughts in their day-to-day life? And we can not just express, negative thoughts verbally, but social media is a big way that we're starting to see people's thoughts. Are you noticing constant negative activity in the person? And that's a major change from what you saw, a couple months ago, let's say. So we're really looking for changes in behavior. Or is the person having a hard time concentrating, hard time focusing? Are you having a hard time staying focused on tasks that you typically would have been able to do before, but now we're finding that, we're becoming very distracted easily? Is speeding or slowing of thoughts? Sometimes when we feel anxious and overwhelmed, is some of us will run around like chickens with our heads cut off, right? And try and do everything all at the same time. And we know when you try to do everything all at the same time, is you end up just getting nothing done and making more mistakes and causing more work for ourselves. Is versus some people, when they feel overwhelmed, they shut down. They're like, I don't even know where to start right now. I have so much to do that I'm just going to binge watch Netflix for the next 10 hours and avoid it. And you know what? We've all done that too. And that's normal and that's okay. But if, again, it's been like this for weeks or months and it's really impacting, that's where we know that there's that problem. And then, of course, in worst cases, is we've got folks that are very severe and are starting to feel that hopelessness to the point where they're experiencing suicidal thoughts. And part of the training that we offer at Ontario Shores is helping people and organizations and individuals, helping people how to better have these tough conversations around suicide. And even on today, Let's Talk Day, it's a hard conversation to have, but it's one of the most important conversations we can have. The more aware we are of somebody experiencing suicidal thoughts, the more aware we are of the warning signs, the more we can talk about it and the more we can encourage a person to reach out to professionals, or we reach out ourselves. And that will be my next set of slides, is our action plans for a crisis versus a non-crisis. Now, this one is our behaviors. These are probably the most noticeable things to notice in your employees and your colleagues and your family members and friends. And so really pay attention to these behavior changes, because sometimes people don't want to talk about their mental illness because of the stigma. But look at behaviors and changes in behaviors as an invitation that this person doesn't know how to bring up the conversation. So they're inviting you to talk about it by showing you that they've changed. And so first of all, one thing you'll notice is decreased productivity. This could be, if it's a younger person, their grades are dropping. If it's an employee that you have that is typically, always on time, gets their job done, and now you're noticing that they're falling behind, they're absent more. Is loss of motivation. Is we all experience times where we're just unmotivated. Like that's pretty much me every January after Christmas. I'm sure many of us feel the same, right? The holidays, you're so busy and then it's full and we're done. But here's a big indicator when we've lost motivation to the point of possibly needing support, is if you lose motivation in doing the things you love to do. It's okay to, not really want to clean or, not really want to work as hard as we usually do. But if we get to the point where we stop doing what we love, that is usually a big behavior change. For me, I love to sail. And so I always tell my friends and family, if one summer I say, I don't want to sail, know there's something wrong with me. So if you see your friends this year that love to ski and the ski hills are open this year, which is great, and they're saying, oh, I'm too tired, I can't be bothered, I'll go next week, that's when you really kind of look out, is recognize that they've lost motivation in the stuff that they love doing. So hence the loss of interest and enjoyment is even just loss of interest and enjoyment in the simple things, is cooking. For a lot of people, that is something that they enjoy doing, and now they can't be bothered. Reading, gardening, whatever it is. Isolation withdrawal. This is a pretty big one you'll notice. It's the person that's calling in sick more. It's the friend or family member that's not reaching out like they did. Is they're retreating more. They don't want to talk. You haven't heard from them in weeks. And that is not typical of them. And then also be mindful of addictive behaviors. So I'm going to share with you a few signs to know when our possible substance use is getting to the point of disruption. But before I get to that, I do want to talk about the physical health symptoms that we experience when we experience mental illness. A lot of people don't correlate physical health symptoms with illnesses like depression and anxiety, but there are a ton of physical health symptoms because remember, your brain is controlling your body. Is when your brain gets sick, it's going to send all sorts of signals to your body that are different than what your body needs. And so then your body can start to experience a lot of these symptoms. Is especially when it comes to anxiety, is remember anxiety and fear are essentially our fight or flight responses. Is it's meant to, get our body moving, is to get our body acting so that we can get away from this stressful or threatening event. And so is through years of evolution is we basically develop these symptoms to help us run away from like a bear, or run away from a lion. The problem is we fast forward to modern times and, what are we all doing right now is we're all sitting. We're not using the energy that our ancestors did in order to find food. Is now we sit in front of our computers and it helps us pay our mortgage and grocery bills. This is a little different than having to hunt and, find berries. And so is your brain is going to send these signals. The problem is if we're constantly thinking we're being threatened, if we're constantly in the state of anxiety and fear, the brain is continually sending these signals that are there to help us, but your body can only handle so much. So it starts to shut down and you feel things like easily tired, disturbed sleep. You can start to even experience body aches and pains like muscle fatigue because we're constantly in that tension, fight or flight mode, constant headaches from the brain, just overworking, heart palpitations, chest pain, rapid heartbeat, flushing. For many people that experience panic attacks, it can often feel like a heart attack. Hyperventilation, shortness of breath, the lungs are being overworked. Our brain is being overworked, so we can feel that dizziness. The whole nervous system can experience excessive sweating, tingling, and numbness. And then finally, our gastrointestinal tract is we can get a lot of nausea, vomiting, diarrhea. These are signs that we're sometimes too anxious. And we've all felt these, when we're nervous, is if you're doing a presentation and you feel butterflies in your stomach and you're sweating and you're shaking, that's normal. But if it's been 4 months of constantly having anxiety and depression and feeling excessive headaches more often, having severe stomach issues, that's where we want to make an appointment with our doctor. And oftentimes you'll find that people with mental illnesses, they'll recognize the physical symptoms before the cognitive symptoms. They'll go to their doctor and then recognize like, hey, this isn't actually anything wrong with my stomach, or, this isn't anything wrong with my back. This is actually because I've been depressed or anxious for a few months. And so it's because, again, our brain and body all interconnected. And so unfortunately, rather than seeking out medical professionals, a lot of people start to use substances as a way of coping. And this is a big thing to look out for. And CAMH actually reported that 25% of Canadians aged 35 to 54 have reported that their substance use has increased during the pandemic versus about 21% of people 18 to 34. So many of us, we made a lot of jokes about it, like, thank God the liquor store is still open and, is things like that during the pandemic. But if you're noticing that you're starting to experience any of these symptoms, this is where we know that we might want to reach out to professionals. So it's okay if you a little bit more out of boredom, is out of joy, is if you really like your wine or whatnot. But if it's getting to the point where we're using more of the substance for longer periods than intended, if we want to cut down or quit, but are finding it difficult, If we're spending more time using this substance, obtaining it, recovering from its effects, neglecting our responsibilities at work, school, or home, continuing to use despite having relationship issues with spouses, partners, friends, family, colleagues, using in ways that are hazardous to self or others, like driving your car, going into work, is continuing to use despite experiencing physical health problems caused from the substance. And then also having cravings, tolerance, or even withdrawal symptoms when the substance is not in your system. And so for anyone that is possibly experiencing at least 2 or more of these symptoms, that's a good reason to reach out to a medical professional and make that family doctor's appointment. Because oftentimes you'll find that when people are using substances, they're using it as a way of coping with some other underlying, mental health issue. And we call those concurrent diagnoses, and try to treat them concurrently now. And so now that we've kind of talked a little bit about recognizing some of the symptoms and what to look for with people with mental illnesses, most people really want to know is, how can we help? And so at Ontario Shores, we offer lots of training programs to teach people how to have effective conversations. But I always like to share, action plans in a simple crisis versus non-crisis in all of my presentations, because for anybody that even feels triggered, hearing this conversation, is to please reach out to a crisis line. Is in Durham Region, we have Durham Mental Health Services. Durham Mental Health Services has a mobile mental health crisis unit where they can come and they can talk to the person and possibly take them to the local hospital if needed. If it's an emergency situation where there's no time to have a discussion, we're going to call 911. And then I've also included this Canada-wide crisis line. This is a really wonderful tool to use if you have questions about a person experiencing severe mental illness. So if you have a loved one that you're really concerned about, is you're concerned that they're having suicidal thoughts, is you're really worried about what's going on with them, you can call a crisis line to ask questions and get information, even if you're not with the person, even if you're not in that moment. So that is 24 hours. You can call that anywhere across Canada. However, again, if you're in the moment with a person experiencing mental illness, call 911 or reach out to Durham Mental Health Services. For anyone located outside of Durham, find your local crisis line. Ask Google, ask Siri. It'll be one of the first things that'll pop up, and know those numbers and program them in your phone if you have a person that's experiencing severe mental illness in your life. And so in a non-crisis, find local resources. First of all, I always like to say is, if any of those signs and symptoms resonated with you today, is if any of them, really you felt that it's something you're experiencing or a loved one, make that family doctor's appointment. Call a telehealth network, talk to a nurse on the phone to see, hey, is this a reason to possibly speak to my doctor about this? Now, being in Durham Region, pretty lucky because you get one of the 4 mental health hospitals. And so Ontario Shores, we are a resource for everyone in the area. We just updated our website. It's really cool. If you want to look at our programs, go onto our website. You can choose from a drop-down menu based on age, what the needs are. And we don't just offer inpatient services. We have outpatient clinics now as well in Peterborough, York Region. There's one in the Whitby Mall. So there's lots of outpatient programs that we offer to help. Now, most of our patients are going to be on the more moderate to severe level of mental illness. And so if somebody isn't quite at that level, check out CMHA Durham, so Canadian Mental Health Association. They have some wonderful services, and lots of them are, most of them are free programs. They can tell you what other programs are in the area. And for any of you that do have a workplace EAP, employee assistance program, it's a great option. They're confidential, they're free. You're going to get access to a counselor or trainer much sooner than you would if you're using the public healthcare system. So Ontario Shores, we are a provincially funded hospital. So we unfortunately have wait lists that come with that. But if you have a workplace EAP, you'll find you can get those services pretty quickly. But also check out, CMHA Durham, great resource. I also wrote a blog for a lot of folks. It's posted up on our website right now, but is one of the best ways that we can help someone today is, today is a Let's Talk Day, but it's also really should include that let's listen. Because, for those that are wanting to talk today, is let's be those good listeners that help them. And so I've given a few tips on how to support someone who is, talking today about their mental illness or talking any day about their mental illness. And again, kind of what I said about the behaviors is don't be afraid to start the conversation, is approach them. Say specifically what changes that you've noticed in them and let them know that you're concerned. I've noticed that you've been missing more work lately and I'm worried about you. How are you doing? And listen to understand, not to fix. I know there's a lot of fixers out there that somebody says they've got a problem and we just want to jump in. We want to tell them how to fix it. But when it comes to mental illness, is the better strategy, and part of fixing it is listening to the person, is because it helps us understand what they're going through. It helps them understand what they're going through. Is when we are listening, the third one is we want to avoid making assumptions about what they're going through or telling them what they should do. Nobody likes to be told what they should do. Is rather asking questions. What do you think would help you right now? Is have you ever thought about reaching out to a counselor before? Would a support group be better for you? Is can I help you find these? These are all much better ways to have these conversations and show that you're listening to the person. We're not telling them what to do. We're asking them is for their input. Be aware of your own biases and stigmas. Today is all about a day of talking about mental illness so that we reduce the stigma around it. And so just be aware though that, hey, we still have them. We're human. We judge. We have stigmas. We grew up with a lot of these stigmas and it's not easy to let them go. So just be aware if you're thinking in your head things like, oh, this person's just lazy, is they need to start doing things. Is be aware of those sort of, possible thoughts that we might have. When we're aware of them, we can rephrase them in our mind and say, hey, maybe they're not lazy. Maybe they're having a hard time. Maybe this is, them expressing what's going on with them. When we rephrase those judgments in our mind, it'll help us in our conversations with them. And then learn to set healthy boundaries. I could talk about this one for days. People always ask me about it is, when is it okay to take that step back? I often do say, if you are supporting a loved one with severe mental illness, make sure that you talk to a counselor yourself, learn how to set limitations and boundaries with them. But check out the article if you want. We publish all sorts of content around mental health. So Ontario Shores, we've got our own blog. It's #MindVine. There's lots of podcasts, lots of blog articles. If you want to know more free information about mental illness, please check us out. Follow us on Facebook, Twitter, Instagram, all those good ones. We're at Ontario Shores. We also offer lots of other training programs for businesses in the area. I've been doing this for 7 years now. I've trained thousands of employees across the country, mainly in Durham region. And so we offer a mental health first aid training course. We do half-day workshops, town halls, and we're starting hopefully a new one, which is a 4-hour training just on suicide prevention. And so but I'll give my contact number, and this is just some of the results that we've seen is that coworkers are more likely to feel comfortable discussing their mental health concerns. The blue lines were before taking the training, the red lines were after. Another just result that we have is that, before the training, employees were afraid to talk to their managers about mental health versus after the training, they felt more comfortable having these conversations. And that's really what training is about, is helping us to talk and become more comfortable having uncomfortable conversations for us.
Thank you very much, Christina. Your presentation was insightful and certainly makes you realize the issues that exist. I'd also like to thank Enbridge Gas for sponsoring today's program. On behalf of the Scugog Chamber of Commerce, I'm Jonathan Van Bilsen. Thank you for watching.